I've washed my hands and gathered my supplies. My supplies include an orange wood stick, emery board, and nail clippers if my resident is not a diabetic, on blood thinners, or have any type of peripheral vascular disease. Face cloth, a towel for the resident to protect the table, a barrier for the table, and a towel to dry their hands with, along with a linen bag.
Come in.
Good morning, Miss Kayla. How are you?
I'm good. How are you?
Good. Well, I'm Linda, your CNA, and I'm here to provide nail care for you. Will that be okay?
Mm-hmm.
Wonderful. Hi, Mrs. Smith. How are you?
I'm good.
I will be there to take care of your personal needs as soon as I'm finished with Mrs. Kayla.
Okay.
I'm going to set my bag over here on the bed. Get that ready for my dirty linen. Miss Kayla, would it be okay, sanitize my hands, would it be okay if I remove your things from off the table and get your personal items out of your drawer?
Yes. It will.
Great. Create for myself a barrier. There we go. And then I'll get your personal items out of your drawer. The things I will need will be soap, lotion, and your baby. Alright? Miss Kayla, I'll be back. I'm going to go get some water. Alright. Here we are, Miss Kayla. Would you mind testing this water first to see if it's warm enough? The temperature should be at 105.
Yeah, it's fine.
Feels good? Now, if you were not able to tell me if this is warm enough, then I would check it by dripping some water on my wrist or checking it with my elbow. Mrs. Kayla, will you mind going ahead and putting your hands in the water, because we're going to have to soak your hands for 5 minutes. And while we wait, we can cover your basin and your hands with this towel. This will help to keep the warmth in. Otherwise, 5 minutes is usually not long and not too long for your hands to be soaking in. So you should be okay. We could probably do this without covering it up. So 5 minutes later, your hands feel pretty good now?
Mm-hmm.
All right, well, let me sanitize my hands and put some gloves on. Wearing gloves is optional during nail care. It really kind of depends on your resident. If you think you're at risk for coming into contact with body fluids such as stool, feces, then by all means wear gloves. We're going to first start off, Miss Kayla, by pushing back the cuticles of your fingernails. The cuticles are just simply the skin that surrounds your nails. So gently we're going to push back. Is that okay? Am I hurting you?
No.
Okay, great. Okay, wonderful. Now we're going to go ahead and wash your hands. Putting a little soap on the washcloth. We don't want to leave the soap in the water because then the water will become too soapy. Alright, Miss Kayla, let's wash your hands. Okay, you can rinse it off there in the water. Get your hands nice and clean. Now, hand and nail care is usually done in the morning as part of their AM care. You have the option, though, to do the nail care separately from the rest of the AM care, just depending on resident comfort and preference. Alright, Miss Kayla, so thoroughly rinsed your hands off. I'm going to take this orange wood stick while your hands are still in the water and clean up underneath your nails. We're going to make sure that we use the blunted end of the orange wood stick. We never use the pointed end in long-term care. So with the blunted end, the beveled side of the orange wood stick, we're going to gently just clean up underneath your nails. I'm hoping you can get a good picture of just exactly what I'm doing here. There, cleaning up underneath Kayla's nails. using the blunted end of the orange wood stick. Alright, let me see your other finger hand. Are you doing okay, Miss Kayla?
I'm doing fine. How are you?
I'm just awesome. Just so glad to be of service to you today. What do you have planned for the rest of the day?
Well, I have a doctor's appointment that I'm supposed to be at later on today.
Oh, really? Well, your nails will be nice and ready for your doctor's appointment. All right, let's rinse off any residue. Okay, you take your hands up out of the water, and we'll dry them off. Making sure we dry them thoroughly. Okay. Okay, Miss Kayla. Now we're going to clip your nails. Again, we do not want to clip the nails of residents who may be a diabetic, on blood thinners, or have peripheral vascular disease. To cut the nails, we're just going to go straight across, clipping straight across. So we have clipped all the nails. And make sure we get permission to clip the nails because some residents prefer longer fingernails. And then after we have clipped all the nails, and to file using an up and down motion, filing away all the rough edges so that they will not scratch themselves. Okay, Miss Kayla, just a little rough edge there. Again, up and down with the emery board, filing away the rough edges. Okay. And we would do the same for the other hand. Alright, let's move some of this nail dust away. Alright, Miss Kayla. There. Would you like lotion on your hands?
No, thank you.
Lotion is the finishing touch. Let me sanitize my hands after removing my gloves. Lotion is the finishing touch for nail care, for hand care. I want to make sure that their hands stay nice and moist, lubricated, and supple. So we put a little lotion in our hands, rub to get them warm, get the hands warm, and then we apply the lotion, gently massaging the hand. All the residents love this part of hand care. They love the lotion and the massage. Alright. There. Okay, Miss Kayla. I'll wipe away any excess lotion. There. Okay. Wonderful.
Thank you. My nails look wonderful.
Well, I am so glad that you're happy with the care that I have provided. Alright, so your orange wood stick and your emery board will go in the garbage. Though it has a pointy end, it's not really a risk. Some facilities will say put it in the sharps container. Others will say just throw it away in the garbage. However, the nail clippers, if we do not reuse the nail clippers after sanitizing them, the nail clippers will go into the sharps container. So for us, our facility's policy says that we will just sanitize the nail clippers and store them in the shower room in the resident's own personal bin, away from the bedside, so it will not be a hazard for them. Now I'm going to go and take care of your equipment, okay, Miss Kayla?
Okay.
Let me sanitize my hands again and put on some gloves. Won't you please join me in the bathroom as we take care of her equipment? Okay, having washed my equipment or sanitized my equipment and sanitized my hands, I'm now ready to put my residence belongings away. Her lotion and soap back into the drawer. Nail clippers belong in the sharps container. Emery board and file are thrown away. Okay. Place everything back within reach. Mrs. Jones, here's your personal belongings, your call light. I'll open up your curtains so that we do not isolate our residents. Sanitize my hands because it's always the last thing that I do before I leave the room. Mrs. Jones, are you comfortable?
Yes, I am.
Is there anything else that I can do for you?
No, thank you.
Wonderful. Mrs. Smith, I'll be right back in just a few minutes to take care of your needs.
Okay.
All right, goodbye, Mrs. Jones. I'll see you in a couple of hours.
Okay.